Well, hello, everyone, and thank you for attending our Axiom live chat with leadership. My name is Holly FOXWORTH. I'm a registered nurse here at Axiom Medical, and I'm also joined by Axiom's President and CEO, Mark Robinson, Chief Medical Officer, Dr. Scott Cherry, Chief Marketing Officer, DARA Wheeler, and Chief Legal and HR Officer, Chuck KABLE. So, I think this may be our largest number of participants that we've had on the live stream to date, guys, so welcome.
Thank you.
Thanks, Holly.
Great. Well, before we get started, and since we do have such a range of representation today, let's have you guys introduce yourselves and tell us a little bit about your background. Mark, would you like to go first?
Yeah, first of all, I'm going to apologize for that much younger photograph of me. I need to get that updated. As you can see, I'm not that young anymore. I'm the CEO at Axiom Medical. I've been here about 4.5 years, actually 4 years and 9 months. And actually, yeah, 4 years, 9 months, and a few days. Anyway, it's the best job I've ever had. I love it. Everything we do helps people, and particularly now in this COVID era, we make a huge difference in the lives of our clients' employees, providing a feeling of safety and security in the workplace. And for me, that's such a valuable contribution to a currently very difficult world.
Absolutely. DARA, would you like to go next?
Yes, thank you, Holly. I'm happy to join everybody here today. My name is DARA Wheeler. I'm Axiom's Chief Marketing Officer, and I've been with Axiom for 14 years. I really love what we do, and I'm really excited to continue the conversation about employee health and wellness and how we support employers by being safe in the workplace.
Fantastic. And Dr. Cherry?
Yeah, good afternoon, everybody. It's a pleasure to be with you today. My professional background is I'm a preventive medicine and occupational environmental medicine physician that has been supporting either the military, large corporations, industries, and happy to be bridging population and personal health into the workplace.
Great. And then Chuck?
Sure, Holly, thanks. Good to be here, everybody. So my name's Chuck KABLE. I am in charge of legal and human resources at Axiom Medical. I've been working with Axiom for about 4 years, actually. And I have developed through the course of my career, I think, a pretty specific focus on how we should manage risk in organizations. And that skill has certainly come to bear recently here at Axiom Medical. So I'm happy to be part of this conversation and contribute as I can.
Fantastic. Well, as we've spoken about so many times, the circumstances that we have faced this year with the pandemic, they've really brought forth a lot of new opportunities for doing what we do best, which is developing solutions and best practices that protect and care for various populations, whether that be in the public sector or the private sector. We've expanded our reach to new industries and really kind of helped them find safe ways to return to work. And one industry that I was hoping that we could discuss today a little bit further was the TV and film production industry and what their safe way forward looks like. So would one of you want to maybe kind of give us an overarching view of how it is that Axiom has been partnering with some of these productions to keep their cast safe?
Yeah, I can start, Holly, and then I think having Chuck jump in with some of his review of the guidelines would be really helpful. So there was a paper that came out with a lot of guidelines from medical professionals and people that are experts in population health and wellness about the safe way for movie and television productions to reopen and how to manage the shows and the movie sets and create a protocol that would protect them as best as possible. So those guidelines have since been adopted into an agreement with the unions, I think, and Chuck can give some more details around this as of last week. And those guidelines include things around testing protocols, how to handle positive tests, how to handle symptomatic individuals, contact tracing, all of the above. So since the first productions came back over the last few months, Axiom's been supporting many different productions in their operational side of those guidelines and how to deploy the best practice around those layered approaches that they've been working on through those guidelines. Chuck, I'll pass it over to you to give some more context in that as well.
Sure, Dara, thanks. I mean, I definitely think that when the original white paper was published speaking to this proposed way forward, there was very much a confluence of ideas and a confluence of information and other guidance that had to be synthesized and very quickly in order to allow some of these production companies to begin to understand what it was going to take to go back to work. So what we originally did was take whatever guidance we found that was put out by primarily these unions and other industry organizations, and begin to have discussions with some of these production companies about what we could do to help support compliance and safety of these sets. Flash forward a few months now, so on September 21st, there was actually an amendment to collective bargaining agreements that was entered into that specifically took these kind of pieces of guidance and that confluence of information and distilled it, I think, to a better, more informative, easy to understand approach that's to be utilized across the country for these various productions and as they begin to kind of go back to work. And so I think Axiom has been instrumental and been there every step of the way in providing service and providing the ability for these productions to understand what it takes to maintain as safe and as healthy an environment as possible. There's a combination of staffing solutions, testing requisition services, and a whole bunch of back-end support that we provide to make that happen.
Great. So what type of outcomes have we seen to this point for the productions that we've assisted with? What have been the outcomes that have came with that?
I can take the first stab at that as well. So we've been incredibly successful. We've prevented any major outbreaks or any concerns around having to shut a show down prematurely or delay productions. And we've done that really in that close partnership with the production companies and the unions and the staff, and worked really hard to develop different ways of approaching these protocols to protect everybody that's there on set. So there's been a lot of flexibility and creativity for the teams that often are very used to, they may be multiple seasons into a production and have a very streamlined approach to these productions. And unfortunately, throwing a pandemic into the middle of that has caused a lot of stress and anxiety across the industry. But partnering very closely with the productions, we've been able to maintain the operations of the production and keep everybody as safe and healthy as we can. And Holly and I look very closely over time at positivity rates, and those positivity rates for productions have been incredibly low. I think as of today, it's something below 0.24% of all productions we've worked on have had positive outcomes. So I don't know if anybody else on the team wants to jump in as well.
Yeah, I'll jump on that for a moment. Just to clarify, 0.24% of the COVID testing that we've done on productions have produced a positive COVID test, and that compares to somewhere around 8.25% in the general population in the areas that we have been supporting these productions. And that's a reflection of a bunch of things. First of all, the guidelines, which have morphed into a contract amendment now, a collectively bargained contract amendment proposed by the various unions, the craft unions, SAG-AFTRA, etc. Those guidelines are thoughtful and really quite effective. Secondly, when employees of any company, and we're talking about film productions now, when they're exposed to every day the protocol of having to assess whether they are at risk through exposure or currently symptomatic, and then when they're being tested every few days, and when their workplace is being monitored for compliance with social distancing and with wearing masks wherever appropriate, that lesson sinks home to those people. And those people take that lesson home with themselves, and they start managing their outside work environment with the same awareness of risk that they're managing their at-work environment. So I think there's two benefits. There's the primary benefit of managing the set and exposure and risk on the set, and there's a secondary benefit of creating a degree of risk awareness and modified behavior on the part of all the employees that combine to reduce that rate so far below the the endemic rate in the local populations.
Those are really good points. I've heard several of you kind of refer to approaches. So could you maybe explain what it is that's unique about Axiom's approach, how we are taking these programs and kind of steering them in different directions?
Dara, why don't you take the first shot?
Sure. I do think I mentioned the layered approach Axiom takes, and I think that's critical. Our expertise, and luckily Dr. Cherry is on our team, and that subject matter expertise that we've got in building these approaches is critical to the success. And when we talk about layered approaches, it's an approach that makes a population and helps reduce risk. So while risk will never be zero, it helps create an environment where you've got these different layers, including environmental and safety controls, hygiene, and making sure, like Mark said, that some of the behaviors change, ensuring people are wearing PPE, layering that testing protocol on, making sure that employees are taking any symptoms or exposure seriously. And we've seen that by taking that layered approach, if for some reason the supply chain in the United States has some struggles around the testing that's available, that is only a component of the layers and the different protocols that we've created. So that does not then put the entire production or environment at risk because we've built all of the other layers. Some of the physicians and Dr. Cherry's colleagues that we've worked with also call it the Swiss cheese approach, where you layer those stacks of cheese that have holes on top of each other, and you're plugging up as many of those holes as you can by that approach. So that's been the Axiom way of managing these return to work processes and procedures.
I think there are basically 4 layers that we think of this in. There's the syndromic surveillance layer, which for us is the most critical, that we're driving employees to consider for themselves what kind of risks they have been exposed to or what kind of symptoms they might currently have, and to act responsibly in regard to taking those into the workplace. And then we've got the testing layer, which actually provides some evidence-based information for disposing of employees one way or another. Disposing is a bad word. I mean, the disposition of them with regard to the illness. And then we've got the environmental approach, which is about behavior in the workplace, adopting the right protective measures, the right hygiene measures, controlling that those measures are actually applied. And then finally, we've got the behavioral modification layer, which is educating people to the point where they know and understand what risks they are undertaking for themselves, and what risks they might be exposing their co-workers and their co-workers' families to if they don't behave responsibly. So that those 4 layers, and even within the layers, there are layers. Like you can have a testing protocol that comprises PCR testing plus antigen testing. You can even use antibody testing as a method of determining whether individuals have pre-existing immunity. So within layers, there are layers.
Great.
But that is the best way to get there.
Okay. So you brought up the issue of testing, and that's a significant component of what is, included in some of these guidelines. Dr. Cherry, would you maybe want to kind of go through and tell us the difference between that antigen testing and the PCR testing?
Sure. Both of these tests are looking for infection. So you can compare or contrast that to antibody testing, which is looking at your immune response to an infection. So again, with PCR and antigen testing, you're looking at really an active infection in someone. But there's some nice nuance here between those tests. So the PCR test or molecular test, that is looking for the genetic material of the virus. And the antigen test is looking for proteins produced by a viable virus. So there are very unique ways to come to the same conclusion. And right now, there's some similarities and differences in the performance of these tests. Both tests have authorizations through the Emergency Use Act by the FDA, so they're appropriate to be utilized. And that means that they have credibility and evidence that they have a certain performance or efficacy with regard to testing in populations. So the real difference would be the PCR test has a slightly higher sensitivity, meaning its ability to detect disease if the disease is there. And one of the downsides, though, is that there's a persistent positive issue where if someone is infected with COVID-19, but then has recovered either through the 10 days of social isolation, or actually, let me pull back a little bit. The issue with PCR testing is this persistent positive where once someone has recovered after 10 days, since their symptoms have started and their symptoms have greatly improved, there is a potential for what we call a persistent positive where the genetic material of the virus potentially is persisting in our upper respiratory tracts based on our immune system's ability to basically chew up the virus, but you still may have some fragments of that virus. And so the way the PCR actually works is it takes the genetic material of the virus, chews it up, and then exponentially grows it. So again, if you've recovered but have these persistent fragments, then the PCR would remain positive. What's nice about the antigen is that it's looking for protein products of a viable virus, so you don't have that same persistent problem.
Just one element of clarification there for the TV and film industry, the contract amendment, which Chuck will talk about shortly, actually specifies PCR testing as the standard.
And there's some pretty significant differences there in terms of getting results back, the turnaround on some of these, correct?
The turnaround time and cost, right? There are both cost and turnaround time implications because of the nature of the machines and laboratories and skill levels required to operate each of the different tests.
Okay. So in regards to the testing protocols that are there, could you maybe explain how would it be effective to maybe use like an antigen test with a weekly PCR test? What would that look like? What would that process look like, and how would that work?
Scott, yeah,
I can take that. You know, as you said, Holly, you know, some of our clients, especially in the film and entertainment industries, have operating requirements for medical surveillance. So having frequent testing of their employee populations, regardless of symptoms. And in that instance, really everyone, there's a low pretest probability that someone would actually test positive. But again, we're going to do frequent testing just to make sure we're actively surveilling those populations. PCR was the first test out, and it's considered the most efficacious, so it has the highest sensitivity and specificity. Mm-hmm. When you look at antigen testing, it actually also has very high specificity, but its sensitivity on average, if you look at all the tests, are a little bit lower than the PCR tests. So currently, you know, the film industry is really just focusing on PCR testing, but some of the operational concerns are that if you're going to test your crew, staff, and talent, you know, 2 or 3 times a week, having those test results very quickly would help really support operations and also prevent having to do contact tracing and a delayed result, you know, a day or 2 out that ultimately becomes positive. So, you know, with antigen testing, the huge upside is that you can get turnaround times within a day and usually within an hour. And so operationally, that's a huge benefit. And again, if we're going to be doing medical surveillance testing very frequently, the small difference in sensitivity can greatly be offset by this frequent testing. And so, you know, in my opinion, I think antigen testing, especially in a frequent nature, would be really the right choice operationally and medically, since that sensitivity difference can be well offset by frequency of testing.
Okay. So Chuck, did you have some updates that you were going to share with us as well?
Well, I think, just a few comments. I'm not an expert by any stretch of the imagination in terms of the difference between the tests. That's why we have, Dr. Cherry. But what I can say is I do know that from an operational perspective, diving into this new approach that was heavily focused on testing was not without its challenges. The supply chain, various, government action, locking up supplies, labs getting overrun with, tests that weren't expected based on the volumes that were kind of originally talked about, created a heck of a lot of challenges for everybody in this business to figure out. I think what's been really interesting is the way that kind of, first of all, Axiom's been able to manage that very volatile environment and get to what I believe today is a very steady state, with kind of a network of labs across the country that help us deliver this kind of testing cadence effectively. But you kind of layer that with, the amendments that we talked about to these collective bargaining agreements that was passed September 21st. And is still a very clear and distinct focus on multiple tests per week, depending upon, whether you're a zone A kind of an actor, for example, that's not wearing PPE. And so the potential volume and requirement of these tests is not going to go away, at least until we're kind of in the clear from a COVID-19 perspective, and we don't even know if or when that's going to happen, right? So there's going to be this continuing need. I think the other factor that's playing into the way we're approaching a lot of this business as well, the industry is now starting to recognize that cast and crew can transition from one production to another. It's just the way this business works. And so to what extent does it make sense for someone that just had a test yesterday on a different production to then move to a new production and have another test when they just had one yesterday that was negative, right? So I am pleased to see progress in the amendment where they're specifically reflecting an ability to use a test that was performed within the designated timeframes, which shift depending upon where you are in the year, by the way. But there is now a mechanism to allow previously administered tests to be utilized to prove compliance on a new production, right? So in theory, it's great, makes a ton of sense, is clearly the most efficient way to manage this. I think that's where, from where I sit, it's analyzing these requirements and then translating them into mechanisms for our operations team, our clinical teams, to figure out how to make it so, right, to the extent that we're in a position to help manage some of these transition issues. Mark mentioned health attestations earlier. That's in this contract, so it is contractual that health attestations have to be performed on a daily basis, right? Not without its challenges, right? I mean, folks have to get comfortable, engaging in a daily process. And so that, I think, is where Axiom has quickly moved to provide solutions, address concerns and provide kind of this overarching program that I think not only has fit and helped these sets stay safe over time, but squarely resides within kind of the amendments that were just passed on September 21st with all these unions. So that's kind of, those are some of the most compelling things. It's not a short read, right? I mean, it's 40 some pages long, and there are a lot of very specific testing requirements that I won't get into. But those are kind of the big things that I take from this most recent contractual amendment as it relates to these concepts of testing and daily health assessments.
Good points, really good points. So do you feel like then that transitioning to a model where you would utilize both the antigen testing and the PCR, that would get us to a better place in terms of, eliminating some of these bottlenecks that are there, but yet still providing a safe environment?
I think that's the way it should go. But again, I'm not the clinical expert, but I think practically when you look at the strain that these tests are causing on local labs, for example, you have to have a partner that is able to extend beyond those labs to be able to deliver on the timelines that we're expected to deliver on, which are tight. I mean, it's a tight timeline because the business dictates that result.
Right.
Opening up kind of a more layered approach as it relates to testing, it certainly provides Axiom with a better way to provide quick results, through either our mobile lab solution or other lab partners that have kind of a quicker turnaround on antigen testing, for example. So it's a belt and suspenders approach that I think makes a lot of sense based on what we've learned up to today, based on the various ways that these tests work and their effectiveness, as Dr. Cherry just pointed out.
I think it's really, that's really the key. It's about operational effectiveness, right? It's about enabling productions to work smoothly and efficiently with minimum disruption, and doing so with the most convenience for the workers, cast and crew, who are impacted by having to comply with this.
Yeah, for sure. For sure. And there's one point I want to make that I meant to make earlier, but I didn't. I think we talked about kind of our layered approach, right? And I think that not for folks that don't know much about us and where we come from, I think we're celebrating our 21st year in business. I think today I saw that posted. So for 21 years, we've been involved in this occupational health space, okay? Which to a lot of the folks that are asking us for help today is a brand new concept, because historically there hasn't had to be a huge focus on occupational health, right? The health of your workforce. And so for 21 years, that's been our focus. And so everything that we've done to pivot and support these new industries that have come asking for help is based on that 21 years of experience helping employers manage the health of their employees, right? Because I think what we've learned based on a string of bankruptcies and other business failures, more specifically related to COVID, the risk of kind of not doing anything, aside from all the legal risk that can occur, is you lose your entire workforce, right? And then what are you going to do? And so, a huge focus that we're placing today on managing that risk is based on the layered approach.
Excellent points. Well, this has all been great information. Before we wrap up, did anybody have any closing remarks you'd like to make or share?
Yeah, look, I don't want this to sound like it's an infomercial for Axiom, right? This is meant to be an informative dialogue about what works, how it works, why it works, and those solution elements. Obviously, Axiom's not the only partner that can help a production with these issues, and there are other partners who can do great work too. So this is really just trying to help clarify, on the basis of now experience with a large number of productions over several months, what kind of solution elements work, how they work, and why they work.
Great. Anybody else?
Yeah, I was going to echo some of that as well. And thank you, Mark. I don't want to go after you because you say it so succinctly. But I do think that what we're learning every day through this experience is, I want to reiterate a little bit of what Scott said, Dr. Cherry said, about these different testing types and the approach that you take towards testing. They are all data points in this program that we've created or that others have created. So if we're doing and we're working through all of these different data points and we're collecting that information, these are all of the things and all of the points that will help make the environment safe for people to work, or as safe as we can during this time.
Fantastic. All right. Well, again, Mark, Dr. Cherry, Chuck, DARA, I appreciate you all joining today. Just a few quick mentions before we wrap up. Tomorrow at 1 o'clock, at 1 o'clock p.m. Central, we're going to be hosting another follow-up live stream, but that's related to the webinar that we had this last week, which was the importance of effective communication with multilingual populations. So you don't want to miss that. DARA and also the team from Spoken Here will be answering your questions. That'll be on LinkedIn, Facebook, and YouTube. Also, if you're interested in and a little bit more information in terms of how it is that we're helping productions get back to business, you're welcome to visit our website and download a free copy of the Safe Practices Successful Film Productions white paper that's there. It really drills down into not only what we've implemented, but also the results that we've had as well. So as always, should you have any questions about Axiom's Check Into Work, Check Into School apps, etc., reach out to us. We're happy to walk you through it. Thanks again for joining. We'll see you tomorrow. Bye-bye.